Well, good morning, everybody, and thank you so much for attending our webinar today. My name is James Tillman, and I am one of the National Marketing Managers here at Medicare Advantage Specialists. It's an exciting time right now as we gear up for the upcoming AEP, and there's so much opportunity this season, and MAS and our agents are poised to have a great year, and we're looking forward to that. If you're attending a webinar for the first time today, I'd like to introduce you to MAS, Medicare Advantage Specialist. We are a national, recognized, award-winning field marketing organization and a leader in the insurance brokerage industry. Our office is located in beautiful Hoover, Alabama. We're just outside of Birmingham, Alabama. If you haven't yet put your plan in place, this is one of my favorite slides to look at. The question is, if you haven't put your plan in place, you may be asking yourself, how am I going to increase my sales this year? How can I expand my product portfolio? Or how can I get leads? Will I have to pay for them, and can I afford that? Some of you might even be asking, what exactly is my niche market? And how in the world am I going to get the training I need to execute my plan? Well, here at MAS, we have all the answers to those questions and so much more. So before we go to that next slide, I want you to absorb that just for a moment. First question is, are you happy with what you made last year? And if you're not, then the question is, how can I increase my sales? And how do I expand my portfolio? How do I add to what I'm already doing? Always get asked the question, do you guys have leads? The answer to that is yes, and we'll go over that toward the end of the webinar today. And if we have them, you ask yourself the question, can I even afford them? We can help you there as well. I love this question here is, what is my niche market? Some folks, even later in the game, are still trying to figure out what their niche market is. Allow us the opportunity to help you with that, and I'll share more about that at the end of the webinar as well. But these are all outstanding questions, and even if you made all of those changes, where in the world would you get the training that you need? We can assist you there as well. So I wanted you to absorb that screen. Hope you've asked yourself those questions, and if you have, good for you. We'll be getting to more of that as we go through the webinar today. One of the opportunities that is available to you through MAS is becoming a portfolio-minded agent. We will help you learn the Medicare market, including Medicare Advantage, Medicare supplements, or even both. Cross-selling with indemnity and ancillary products like cancer policies, critical illness, and hospital indemnity, all of those things are important, and we can help you there as well. Or by offering life insurance such as final expense policies. Bottom line, guys, is this: by increasing the number of products you offer, you can guarantee an increase in sales and client retention. And you can see the roadmap that we have put there on the screen, becoming a portfolio-minded agent. There's not one agent on this call I know that wouldn't want to increase the number of sales, increase your income, and the things that you deserve. But a lot of you guys need to be thinking, hey, I need to add some more product to what I'm already selling. So we can guarantee you that if you do that, learn the product, that you'll see a guaranteed increase in your sales. And more important than that, you'll see an increase in your client retention, which is always very, very important. Today, we have a special guest, Zonta Turner. She's the sales director with United Healthcare Community and State for the Southeastern region. She's going to share with us some information about year-round selling opportunities in Georgia. So with that being said, Zonta, I'm going to turn it over to you, and we're so glad you're here. Thank you for taking the time. So I'll let you have it from here and share what you have for us today.
So thanks for having me. I'm going to attempt to share my screen. All right. Can you guys see my screen?
Yes, ma'am.
Awesome. So thanks so much. My name is Zonta Turner, and as it was just said, I actually do represent the Southeast. I'm going to talk about the Dual Special Needs Plan and, you know, why you would still be interested in selling this plan. As you all are very well aware, in the next couple of days, AEP is quickly running upon us, and that is the time of year where there's only a small group of folks, small population of folks that actually have access to enroll into any plan throughout the year. So dual special needs is more of a plan that you would look at all year long. And so with that being said, you can actually enroll folks all year long on dual special needs. So, you know, for 11/1 effective dates, 12/1 effective dates, and then of course for 1/1, these folks actually are candidates that you'll probably run across even when you're out there going after that AEP population. And sometimes these folks actually think that it's their AEP as well. So with that being said, we thought it'd be a great time just to tell you about the plans that are available with the dual market. And then of course, Georgia has a great portfolio with United Healthcare of all plans that are available. And if you're not aware, I will probably give you guys some names of folks to reach out to before this presentation is over. So with that, we'll just dive right on into the dual market. How many consumers are actually eligible with the dual population? You know, it's a huge opportunity. And with United Healthcare, we have 6.6 million people that are in our dual footprint, and only 17% of them are actually enrolled in a dual plan. And from a national perspective, there's like 9.2 million and only 15% are enrolled. So what a lot of these folks are going to look like for an agent is they're going to have Medicare, some form of Medicaid, and a standalone Part D. So when you go to actually speak with them, talk with them about their options, when you do actually enroll them, it's going to be that first commission for you. So that's a big deal, right? That's that full commission regardless of what time of the year that you enroll them into a plan. So it won't be prorated by month. So if you do actually enroll someone for 11/1 effective or 12/1 effective, you're getting that full commission, and then you're actually going to be getting that renewal beginning 1/1. So it is a population that tends to be a little more overlooked, underserved, a little more fragile, in some cases more sickly, but they are very receptive of the help of you taking time to actually speak with them. And because it is such an overlooked market, agents are quickly becoming very interested in this population. So, you know, we actually really take pride for United Healthcare in being able to offer members from kind of, we call it cradle to grave opportunities. So in some markets, we actually have them on the Medicaid side, and we get them on, you know, the dual special needs side, Medicare side, and then of course, as you know, we have a portfolio of products to offer. So in some cases, we actually have members from birth all the way to the end. So we do really believe in helping members live healthier lives. And with the dual population, as I mentioned before, because they are in some cases more sickly, a lot of those folks aren't getting the health care that they need. Sometimes some of them are taking medicines that counteract with other prescriptions that they're taking. We'll talk a little bit more about how we can actually help those folks. So what we're going to talk about today is refresh on basics. I do a decent 101 presentation. I think I'll offer it again next month, and then maybe one more time for the year. You know, the focus right now is AEP, but if there's an interest in learning more about dual basics, and you don't get enough out of this training, I will actually let you know when our DSNP 101 is available. So with that being said, it's funny, I've run across agents who actually will be completely focused on AEP, and then they'll call me and say, oh my goodness, I ran into 2 or 3 potential folks just today, and I need to learn more about duals. So that's why we do kind of offer that informational training. So is everyone hearing me okay? I think there's been some feedback that you can't really hear me. Can everyone hear me okay? Which you may not answer because I think they're all muted. So I'll keep going unless I hear that you still are having a...
Zonta, it's a little hard to hear you.
Really? Okay, I'm like all in the computer. Okay.
Okay.
I'll speak louder.
Okay.
All right, so dual special needs, reviewing the basics. So with the dual special needs plan, it's just like any other Medicare Advantage plan. you know, it is tailored around the population that we're going after, which is the dual special needs population. That population, like I mentioned before, is more needy, more sickly, and our benefits actually tailor from head to toe around that population. So you'll see podiatry offered on our dual special needs plan because a lot of those folks are diabetics and need to go into the doctor and get their toenails clipped. So as you see the benefits that we offer, you'll see that it really does tailor around that population. As with our other plans, MedSups really tailor around folks that are in that population, and the Medicare Advantage plans work very similar to group coverage. So also with our plan, it does offer additional benefits that we'll talk a little bit more about specifically. And then it also offers the Part D plan that is baked in. So they have a complete Medicare Advantage plan. They will need to live in the service area where the plan is offered, just like any other Medicare Advantage plan. And then they also will have to have Medicare Part A and B, and they'll also have to have Medicaid. So again, we'll talk more specifically about all this as we go through. But you know, there are a lot of benefits and a lot of reasons why someone would want to be enrolled into our plan, and we'll go into that a little more specifically. All right, so house calls. This is really something that you guys, if you've been selling in Georgia, you're very familiar with. House calls is part of most of our plans. I'll go into more specifically one of the plans that we offer that has a house call nurse program available, but it's like house calls on steroids. But we'll talk a little bit about house calls right here in case some of you are not familiar. And so what happens with house calls is once we enroll someone into our plan, they get what's called a health risk assessment call. They basically do a checkup on their health, kind of like a credit check on their health, and they see, is this someone who's healthy? Is this someone who actually isn't going to the doctor a lot? Maybe they've had a lot of admissions into the ER within the last 2 years. We're kind of rating them to see where they are in their health. And depending upon what their status is, some of them get linked up to a nurse just directly, a nurse that they can call upon 24 hours a day. And then some of them have access to the nurse hotline, and then some of them just get tapestry. So what happens with house calls is once they've interacted with this health risk assessment process, they will actually have what's available to them as a house call. And it's a nurse practitioner that comes out to their home and does a health assessment on them. The visit usually takes about 45 to 60 minutes. It is extremely well received. And so with the dual population more so than others, they're not folks that really go to the doctor a lot. So this nurse program, house call program, whichever one's tied to the benefit, is really essential because these folks probably haven't been seen by a doctor in quite some time. So the nurse program has a very high satisfaction rate. They actually have about a 99% satisfaction rate once the member does take advantage of it. So they do call. Okay. Can't hear me at all. So let's see. I'm not sure how to help this. Oh, okay. So I'll keep talking. So the house call is not to take away from the doctor's visit at all. Actually, all of the information that is assessed from the visit is actually given over to the primary care physician. And with the house calls, it's actually done once a year. So every year, they will get a house call visit. The nurse program, as I mentioned before, is a little more hands-on, but in most cases, it's the same nurse practitioner that they were seen with previously. All right. So I'm going to keep talking, hoping that everyone can hear me. So, how the household benefit is a health maintenance. There's no additional cost. It's very convenient because the nurse to that member's home.
Hey, Zanta, you keep fading in and out.
That is hilarious.
I'm wondering
if I'm not moving at all.
I know. I'm wondering if do you have a phone that you could dial in on versus
Absolutely.
doing the mic on your computer?
I can absolutely do that. Let's do that.
Yeah. Do you see the number on your panel there that it gives you to dial into with an access code?
I don't, but I'll go. I know where I can go. I'll go to the email. Okay. 1 second.
Bear with us, everybody.
Yep, sorry. All right, I'm dialing in right now.
Okay.
Okay, Shanna. Oh, there we go. Can you hear me okay now?
I can, but I think that let me see if I'm.
I'm going to mute myself on here.
Okay.
All right, here we go. Can you hear me all right?
That's better. Yes.
Perfect. All right, so we'll keep talking about nurse program unless I need to back up. That's really weird. Hold on. Let me minimize this. Okay. So how it benefits, we're talking about the nurse program. How it benefits is basically there's no cost to the member. The convenience of it is they go to their home, they're actually doing a health assessment, and then all of the information is taken over to the PCP. Let me advance here. We will probably skip over some of this, but basically how it works with a nurse program and the house calls is they get a postcard, they'll attempt to reach out to them, and then once the member has received it and the reminder of the phone call, then a couple of days later they actually go out and make the visit. So with that, they are actually, like I said, doing an in-home assessment. All the information collected is actually sent over to the primary care provider. So let's get to the meat of the dual eligibles. So any of you guys who are actually taking notes, if you are familiar with our enrollment kits, they actually have this particular chart on the kit. And it's usually around page 6 or page 8 of the kit. It depends on the kit. This chart to me is very, very important. And as you're in front of your potential prospects, if you realize that they're a dual, I strongly encourage you to go over this chart with them. You'll make the verification call through a PhD, but this particular chart shows you, depending upon what their level is, the assistance they're getting. So as you can see, for someone who is a QMB plus, they're getting all of the assistance from the state, okay? Their Part B premiums paid for, any deductibles, owing coinsurances. They're on the highest level of LIS assistance. And with that being said, they're tied to a Medicaid, so they're getting additional Medicaid benefits. So those folks are always a good fit for our dual plans because there's no cost sharing involved with those folks. The state's picking any any of that up, any deductibles, coinsurance. Same thing with those folks who are QMB only. Those folks actually have zero cost sharing responsibility as well. They aren't getting the additional Medicaid benefits. That's pretty much the only difference besides their LIS level that sets them apart from those folks that are QMB plus. Both of those levels are always really good candidates for our dual special needs plans. The rest of the folks are what we call partial duals, and as you can see through the chart, there's some pieces that are not being picked up for them by the state. And what makes them, or qualifies them is the better word to use in this area, is their income and assets. It's all income and assets driven. And so those folks that are partial dual do have some cost sharing responsibility. And so with that cost sharing responsibility, it's not always a good fit for them to be on our dual plan because there is some cost sharing responsibility. Now, when we're speaking of the partial duals, just like all duals, they have a continuous SEP, so you can enroll them all year long. But in most cases, with the partial dual folks, they're better on a local plan, a local HMO, PPO. Those folks, just like the potential that I was mentioning before earlier in the presentation, there's not even 20% of them that are actually tied to a Medicare Advantage plan. So a lot of those folks are going to be that first initial commission, just like any of the other duals. And they're going to have Medicare, Medicaid, and then some type of Part D plan, all right? And it's not so much Medicaid, it's state assistance, really. And those folks are the ones who probably need it just as much because they have a deductible tied to them. They're paying that 20% coinsurance. So putting them on a regular MA type plan is actually now giving them fixed copays. It's allowing them to now have a out-of-pocket ceiling of protection, whereas before they could pay a deductible and 20% coinsurance all year long and can really get expensive for them. So I wouldn't rule out the partial duals. They're not usually a good fit for our dual plans, but they are definitely a potential prospect for us as well. So if you have more questions, again, feel free to attend our DSNP trainings. We do have DSNP 101 webinars throughout the year. I think we'll have one more, and I actually do the training. It's available on our learning and development calendar. And if you want more information because you're running across those prospects throughout AAP, feel free to sit through it. It goes through this information in way more detail. All right, so let's go through state specifics. And this is usually everyone's favorite slide because it shows you your dual opportunity just for your state. So in Georgia, as you can see, there's over 200,000 dual eligibles, and less than 36,000 of them are tied to a plan. So that's why there's so much potential. These folks are out there, they're dual eligible, they have a continuous SEP, they are getting some form of assistance from the state, but they're the folks that really, really are very receptive to getting more help, getting the additional benefits. And as I mentioned before, your partial duals are those folks who are paying out of pocket quite a bit, but could really use help in enrolling them into like a regular MA plan. So as you can see across the entire country, that's pretty much the case. A lot of the states have a really large potential of dual population and really low enrollment. So that's why I mentioned earlier, when you enroll these folks, it's that first-time commission that you're getting, even if you enroll them for 11/1 effective date, a 12/1 effective date, and then for 1/1, you're going to get that renewal again. So because they're that first time, you're getting that full commission. All right, so all the plans and brands of plans that we have is we have the United Healthcare Dual Complete. We'll go over that plan in detail. You have the Care Improvement Plus. We'll just go over the dual plans on those. There are some chronic plans available on the CIP plan. And then Preferred Care Partners is not in Georgia. That's actually in Florida, and the Medica is also in Florida. So we'll be going over the Dual Special Needs United Healthcare Plan and the Care Improvement Plus Plan today. All right, so that's our footprint across the state, across the United States, and we'll go into Georgia specifically. So the first plan that we're going to talk about is the United Healthcare Dual Complete Plan. So if you're taking notes, I would jot down that H number, H1108-002. That's the footprint that we offer. It's Baldwin, Bibb, Clayton, Cobb, Coweta, I think it's Coweta, DeKalb County, Fulton, Gwinnett, and Lawrence. So pretty much all of that Atlanta area. And so although we have multiple plans available on the dual side, this is going to be your lead plan. The benefits on this plan actually are the best. And we'll go into more of the plan specifics in just a moment. But if you have options of, if you're in those counties rather, you're really going to want to sell this plan as your lead plan because the benefits are richer. So we'll go into benefits. So there's 24 one-way trips. So although your folks that have Medicaid or they're tied to a Medicaid have transportation benefits, those folks that are QMB only do not actually get the transportation. So they do have to call 72 hours in advance. It is one-way trips, and it's a 50-mile radius. But if they have a provider that they see that is outside of that 50-mile radius, they can call customer service, and we'll make an exception in most cases. First line health products catalog, that is usually the main reason folks enroll into our plan. It's items that you can see, they're like in Walgreens. Elbow cream, adult diapers. They also have vitamins, cough drops, a lot of the items that these folks can't really afford. And they get $65 a quarter that they can roll over quarter to quarter, and that's the sweet deal about it. If they have a big ticket item like maybe a quad cane that they want to save up for, they can actually save their credits and then get a bigger item. So the way the credits do work is after the end of the year, December 31st, they do go away. So they can roll them over each quarter, but then after December 31st, they do lose them. So for right now, we are in third quarter, so they'd get the $65, whatever they didn't use by the end of this year, they would lose, but then they would start over again January 1 with $65. The next quarter get $65 and so on. The next piece is the dental, and this is pretty nice. They get some comprehensive coverage. They do get the preventative cleanings and exams, but they also get $1,000 towards preventative. So extractions, we have quick reference guides that go into detail of all the benefits that they offer, but usually that is the #1 requested item when I remember I was a sales rep. They do get dental benefits with this as well. They also get vision, which is eye exams every 2 years, $150 towards their hardware, and that's a pretty nice coverage as well. The other piece that's not listed here, which we talked a lot about, which was the nurse program, very similar to house calls, and that's probably one of the reasons that this plan is way richer than the others. And the nurse program is very similar to what you just learned about house calls. The difference with the nurse program is it's done on a more case-by-case basis. So if someone actually has a need for someone to come out and visit them, a nurse practitioner, more frequent, that's what can take place. And the nurses that actually go out and visit on this nurse program are in the Norcross office right there in Georgia. They work for United Healthcare. They're very hands-on. We've been able to hear some testimonies from them. The house call and the nurse program really do save lives. And these people actually really go out and take the time to visit with these folks. We heard a personal story where they went out and visited a member. Their living conditions were not the greatest at all, and they realized that this particular member was going to need to be seen on a more regular basis. As a matter of fact, I think they had to go back within the next 48 hours to visit this person. And so with this nurse program, because it's so hands-on, it really, really brings value to that member. They're actually able to really get the care that they need. And because those folks are local and right there in our United Healthcare office, if you find someone that maybe is in between a transition of care, and I've been there, I've been an agent where you want to enroll someone, but you're really nervous because you're like, you know, I don't know if I'm going to mess them up by switching them right now. If you have someone who you know that you're enrolling and you're really concerned about maybe them being in between, you know, transition of care, you can actually reach out to one of our agent managers and they'll reach directly out to that nurse that we go out and see them immediately. So the nurse program I can't speak highly enough of. I had invited one of our nurse practitioners to join. I don't think she was able to, but it's very hands-on, and from a retention perspective, it's great. What we found with this particular plan is we really don't lose members, and that speaks volumes for the dual population just because of the nurse program that's tied to this. And if we do lose folks, it's usually because they're enrolling into our institutional special needs plan. So it does wonders for our special needs. All right, so selling points, it is a PPO. They can go in and out of network. Our top competitors, honestly, the top competitor with this plan is our CIP plan. We do have WellCare in some of the markets that compete a little bit, but the biggest competitor for us is our own CIP dual special needs plan. And then you can see for the provider network, depending upon the county, whether it's Fulton, DeKalb, or Cobb, all of the hospital networks that we have tied to this plan as well. All right. Hold on one second, sorry. All right, so we'll go into Care Improvement Plus Dual Advantage. So this particular plan, if you're taking notes, it is the R9896021. Same thing, zero cost sharing with this plan. We'll go over the benefits. It's very similar to the plan that you just heard. Probably the two biggest differences is going to be the dental and then the health catalog. So they do get the $65 on the health catalog. The difference with this plan is they can't roll it over quarter to quarter. And then they don't have the $1,000 comprehensive, and they do have house calls, but they don't have the nurse program. Still a great plan. Just if you're in one of those other 9 counties, the other plan is going to be your go-to plan. But they do have very similar benefits. They have the transportation, they have the vision. This one also has hearing, so if you have a client that's interested in hearing. And of course, the benefit of this is the footprint is the entire state. So this plan as well is very rich in benefits, and if you run across a dual, you actually have options in this state. And it does read 30 for the over-the-counter, but for 2016, that's increasing to 65. So if you enroll someone onto this plan, they'll get 30 for the rest of the year, and then starting 1/1, they'll get the $65 in catalog credit. But what will change is they won't be able to roll over those credits. Whatever they don't use by the end of the quarter, they'll lose. Selling points is it is for folks that are Medicare and full Medicaid. The other plan, you were actually able to enroll partial duals, probably not recommended, but with this particular plan, it's only for folks that are full Medicaid, so folks that are QMB, QMB plus. You do have that year-round selling opportunity, zero cost sharing, just like our other dual plans, and then you have open access network because it's a PPO. no referral needed on either. All right, so I'm going to pause just for a second because now we're just going to go into more of the highlights of United Healthcare. Are there any questions? Let me see if I can read on the chat.
Zonta, I don't see any so far.
Okay. All right, so I'm actually going to switch because I think we have some time. I want to see if I can mute my screen. Hold on 1 second. All right, so much better, much better. So the plan, making the presentation. We'll go over this really quickly. There are a couple things I did want to share with you of some best practices that have been working in some other states. And for the last 10 minutes, I'll kind of show you some initiatives that have been working really, really well in other states. But before we go into that, just want to make sure that everyone's aware when you're making the presentation, and this is what I was mentioning before about calling the producer help desk, you'll want to make sure that you are calling the PhD, going over that chart, that page 6, page 8, that actually allows you to talk with them. Okay, you're someone who qualifies as a QMB or a QMB plus, so with this plan, your share of cost will continue to be 0. When you call the 1-800-PhD number, they're also going to give you a pretty long digit Medicaid number that you'll need for the application. So make sure that you do go over that information with them. You know, just like any other Medicare Advantage plan, you want to make sure that you are going over their providers. You want to make sure you're going over their drug formulary and their pharmacy network, and just making sure that it's best suited for these members. We've pretty much talked a lot about this, but this is the promptings for the PhD. When you call them, you're going to select option 1, and then the sub-prompt of 3. You will need the person present, or you'll need them on a 3-way call to verify what their level of eligibility is. And the PhD will have extended hours for AEP, but for now, it's Monday through Friday, 7 to 7. So once you've confirmed all of those questions, you've made sure they're in the right service area, you know, you will enroll them into the plan. A really cool piece about this plan as well is if for some reason they lose their Medicaid, we actually give them a 6-month grace period. So a lot of times what we find is when someone is no longer eligible for our plan, it's more because that person actually didn't go and recertify, go and requalify. So every 6 months, and it depends on certain states, I think it's the same in Georgia, they have what's called a requalifying period where they got to go in and they take all of their income documentation and just basically recertify to continue to be on their Medicaid status. So if you get that call from your member, remind them to go back and requalify, and in most cases that's what it is. They just need to requalify. If for some reason there's a change in status, they actually are no longer eligible for Medicaid or what have you, then what happens is they'll no longer be eligible for the plan and they will become disenrolled in the plan. In some cases where maybe they're changing levels, maybe they were a full Medicaid QMB, or now they're changing to a partial dual, if there's any cost sharing responsibility within that 6 months, they are responsible for that. So if you see that someone's maybe changing levels, instead of waiting until the 6 months is over, I would go ahead and switch them to a regular MA type plan. So won't spend a lot of time here. The only piece that I just wanted to mention is whatever their LIS level is when they enroll, it will continue to be the same. So if their LIS level requires them to pay the $1 and $3 or the $2 and $6, it will continue to be that level on our plan. Some of the things that I would watch for, and I would strongly encourage you to go to Medicare.gov, is our tier level may be a little bit different from someone else's tier level. So what I mean by that is another carrier may offer this particular drug for $0, but we still have it as a different tier, so they'd pay the $1 or 1.20 cents. So just go to Medicare.gov and do that comparison so that they can see exactly what they would pay. But again, they're not subject to the donut hole. They don't have all of the same circumstances as a traditional Medicare person would have. They're going to have some level of LIS where they're paying their lower copay cost, whether it's, like I said, the 1 in 3 or the 2 in 6. It will just really depend on their LIS status, but that will not change when you enroll them onto our plan. Make sure that you're reviewing the summary of benefits. Make sure you're discussing everything. A lot of times our consumers get really hung up on the health catalog or the dental benefits that they forget that they actually really do need to make sure that they're listening to, who's your doctor, what prescriptions are you taking. Make sure that they're understanding that they're enrolling into the plan. So we do have agent workbooks available. We will actually, for 2016, have dual agent books as well. These are really great. They're pretty detailed, but it really helps you as an agent to make sure you're going over everything. So I will tell you, with the dual special needs folks, especially in Georgia, but even across the nation, we have a really high satisfaction rate. We usually find if people disenroll, it's within the first 90 days, and it's because they don't understand what they signed up for. They're not using the benefits. But once we get them over that hump, they really are extremely satisfied with our plan, and they're also really good at referring business. With the dual special needs population, word of mouth is really big, and so agents that have spent some time there really know that word of mouth is what works in this particular population. So they're great at referring over business to you, and they're very satisfied with our plan. From the house calls to the nurse program to the nurse hotline, we also do welcome calls. There's a lot of pieces that we go through that actually really help them to become pretty satisfied with our plan. So with that, I'm going to pause. We're probably not going to go too much over this particular piece. I just want to make sure that I emphasize that staying in touch with them within the first 90 days is huge. You as the agent is usually the reason why they enrolled. So although we make welcome calls, we do the health risk assessment calls, you as the agent is who they want to hear from. So I know you're going to get really busy in the next probably 3 months, but just make sure that you're sending, even as small as a thank you card to these folks once you've enrolled them. It just goes a really long way. So make sure that you are staying connected to them, in some form or fashion. And this goes beyond the duals, right? This is goes even with AEP. It's last step in. So I can't speak enough on the thank you cards we have available. Those on Toolkit, you can actually put your picture on them. I think that's really valuable. They remember your face. They remember the time that you spent with them. But sending those out a couple of days after your appointment will go a really long way. And then maybe just touching base with them. This is kind of a 90-day outreach that you can do. It works really well, and it really has helped agents that have had an issue with rapid disenrollments to really turn that around. But, as you're really busy during AEP, I would strongly suggest even just sending holiday cards, thank you cards, just to stay in contact with them was really, really vital. So the next piece that I'm actually going to go over is just some pieces that have worked in other markets that have been really, really successful. So we've got about 14 more minutes. I'll probably just spend about 10 here so that Medicare Advantage Specialists can wrap it up. But I did want to just share with you some pieces that have really worked well. And this is a really long presentation, so we won't go all the way through it. But hold on, let me find it. Some top initiatives that have worked really, really well with this particular market is really about influencing the influencer. A lot of times as agents, we always try to go straight to the population. And after AEP, I will ask Shanna if she'll let me come back and do this presentation in full capacity where you guys can hear me. and maybe we'll do some face-to-face ones as well. But this talks a lot about how to get in front of that potential market, and not just duals, but any folks that you're trying to get in front of. If MedSup is your focus, if MA is your focus, it's really about getting in front of people that influence that potential population. So, it can be doctors, it can be family and friends, it can even be, flea markets. I've seen agents have a ton of success about getting in front of folks at flea markets, but also retail initiatives have really, really worked. So we'll go really quickly over some top initiatives that have really worked in other states that you'll start seeing more in Georgia as well. But these have brought in tons of results. And again, even though we've used this more so on the dual side, you can actually kind of take this approach in any prospect target audience that you're trying to go after. So Bring a Friend event has been really popular with us in multiple states. They've been very successful in states like Texas and Tennessee. And basically the concept is we have an event, and in this case it's a movie event, where we invite our members out and we tell them to bring a friend. And so we bring them in. They usually are finding their own transportation there. And then we have informational tables from maybe some local vendors, whether it's a diabetic shoe company, Walgreens has attended some of these, and we have them out in the lobby there to answer questions for them. And to be very honest with you, the vendors are really not what brings in the attendance. It's just the fact that we're inviting our current membership to an event. We've even done this with our catalogs. So you heard me talk about our healthcare catalogs, which are a lot of the items that I mentioned you can find at Walgreens. We have the catalogs available on our portal, and we actually have kind of a display box that we bring out with us. So we go out to local high-rises or rec centers, and we have a catalog party, and we show our members, we invite them out as an appreciation. We usually have a veggie tray, and sometimes we'll have a couple little giveaways, and we just invite them to bring friends. But then we show them how to order out of the actual catalog. And again, same thing. It's just that they appreciate that we invited them out to an event. And because we took the time to care that there are members and saying thank you, they are very receptive to this concept. And then they bring a friend, and because they bring a friend, the friend kind of gets a little like, hey, I want to be on a plan that appreciates me. And so they come out and, whether it's the movie event or the catalog party, and they want to be enrolled in the plan as well. So Toolkit is where you can find a lot of these flyers. This time of year, we also have member invite a friend events with holiday-themed flyers. So I've seen a lot of success around agents doing holiday events where the members bring a friend. And if you go out on our toolkit, you can actually do it themed for Halloween, themed for around Christmas, although we're not really going to call it Christmas. We usually call it holiday, Thanksgiving, what have you. And where you see popcorn on this flyer, it changes. So it may be the holiday theme, it may be the Halloween theme, but all of these flyers are available on Toolkit, and it's definitely gone over very, very well and helped agents to really boost up their sales. This is just some pictures from some of our holiday events, not holiday, movie events. Another piece that's worked really, really well is the network providers. Kind of goes back to that influence in the influencer concept. So before we talked about our own members influencing prospects. Now it's about finding providers that influence our prospects. So I brought up podiatry as a benefit that is available on our Dual SNP plan. And the reason why podiatrists have been really successful is because we do offer 4 podiatry visits to our duals. And because a lot of those folks are diabetic, podiatry coverage is really big. But another reason is because podiatrists really aren't agents' go-to provider. But we've seen some success in the markets where agents are really kind of honing in on podiatrists and saying, hey, I want to help you build your clientele. You know, let's maybe work together in having some, you know, community events to really build up the initiative that we offer podiatry benefits on our plan, but that you're also available to offer this benefit. Home health agencies has been another one, but the true key with it is just follow-up. What we have found is with providers, when agents do go after that approach, they're really not staying consistent in following up with that provider very, very long. Retail strategies, some of you may be involved with some of the ones with United. It is definitely an approach that works. We have a lot of pieces available. As you can see, this is actually out of Texas, but these banners are also available to agents that may have a retail strategy that they're interested in. This particular table is out of Texas, but as you can see, there's a tablecloth, there's pop-up banners, there's all kinds of United Healthcare marketing materials that are available. The lead box stations have been really well received as well. Kind of does the work for you when you're not there, but if you're interested in any of these pieces, feel free to reach out to Shanna or a Medicare Advantage Specialist. And then again, before the end, I'll mention the agent managers that are in the market, which is Greg Hollis and Pat, who can also help you that work for United Healthcare. This particular piece is really nice. The reason why I'm showing you guys this is a couple of things. As you can see, this whole kind of counter is wrapped by us. So if you see a potential opportunity where you can get into a retail store, this particular place actually was not being worked. It was a tax preparation guy's area that he actually doesn't use from the months between May and May to the first of the year. And so we subleased it from him and actually were able to tailor our information around the booth. So if you have opportunity like that, feel free to reach out to us. We'll be more than happy to co-op with you. But this has definitely brought in a lot of results. And again, you'll probably hear from us again at the first of the year, and we'll talk more in detail. But if you run across any of these potential opportunities, we'll be more than happy to co-op with you and bring in some apps for you. Food banks have been really big. If you're not already in one, I strongly suggest before the first of the year you get into one. They bring in a lot of results. That's where a lot of our low-income population does go. But again, not all of them are dual eligible. Some of them are just Medicare eligible. And a lot of the churches actually have what they call commodities days that provide food to just Medicare population. So low-income areas and community clinics have been really, really big. This is where a lot of some of our potential prospects do go. We found a lot of success going out to FQHCs and low-income community clinics. So those of you that are working the exchange, this is a great place that you would want to be, setting up a table, an informational table, maybe doing some lunch and learns for the staff to show the products that you offer as an agent. These have gone over really well and brought in a lot of sales as well. Mobile home parks is a pretty overlooked one. This is an area where a lot of our seniors live, but also our dual prospects live. And there's a tool called Info USA for those of you that are taking notes that work really, really well. If you're looking at doing some mailings, again, doesn't have to just be duals. You can use this on all of your prospect potential, but it works out really, really well. It has a draw and design feature, so if there's a particular zip code that you're looking at, it will actually show you how many potential leads are in that area, so check that out. And this is actually a sample of Info USA. And then as you can see, after we kind of did the draw design feature, we saw that there was 89 leads just in that one little area. So pretty nice piece. Those of you who haven't used Info USA, I've definitely found success there. Let me see what I'm doing on time. All right, so just a couple more things. Low-income housing's been very positive, and then just kind of doing expos with churches. This has been really, really successful as well. This was actually a church that we partnered with, and we went out and said, hey, we want to help you grow your membership. How about we do kind of a community expo event? And because we came in and helped them do this event, it brought in, I think, like 300 attendees, and we brought in local vendors, utility, cell phone people, and just set up a community day. So I'm going to stop there. I know I've shared a lot of information, but I don't want to take up all of the time. Again, if you have any questions for United Healthcare locally, you've got Greg Hollis and Pat Sorocha. If you need their information, I'm more than happy to pass that along to Shanna. And I'll just stop here and see if there's any more questions.
Yep, there is one question, and it's regarding the dental benefit, and the question is whether or not it will cover dentures.
We do not cover dentures at this time.
Okay. All right, I think that's our last question. That's the only one so far. That means you did a great job. I'm going to go ahead and I'm going to then turn it back over to James and make him the presenter. And he's going to just wrap us up really quickly. Zonta, we appreciate you being with us today. I know it's a lot of information, and we'll certainly want to try to do this again, and then, like you said, maybe schedule some stuff that'll be locally in the markets. So, James, with that, I'm going to turn it back over to you.
All right. Thank you, Zonta. I appreciate your time for coming on this morning. And, guys, we're just going to wrap up real quickly. We've got a couple of minutes left, and we always get asked about our LEAD program, and what you see on your screen there is what we call the Elite Agent LEAD program. Basically, we co-op with agents that are contracted through MAS, and if you're a producing agent especially, we'd love to help you out there. You can give us a call after we get off the webinar this morning, and one of our marketing managers will go into more detail about how that program works. But we use 3 different lead companies and have gotten some great returns, especially with a couple of those. So feel free to give us a call. I'll give you the number in just a moment. Also ask about, I'm not going to go into great detail here about the 100 free names and how that might work for you when it comes to selling. And also we have a new agent fast start bonus program. So these are just a little bit of ways that we assist and help our agents. And another one real quickly is the prescription drug discount card. It's a door opener for prospecting. It's a free value add for your existing clients, an average of 30% savings on prescription drugs offered through the new benefits program. And there's discounts on this card available for dental, vision, hearing, and vitamins. I do know this card works personally. Myself, I've used it at Target Pharmacy, and it has saved us money on some prescription drugs that we are having to use in our homes. So it's a great opportunity for you as an agent, as a door opener. If you're struggling to get in front of people, this is a good way to do that. You can also ask our marketing managers about that as well. I'll leave you with this, because why choose MAS? The bottom line is we are here to serve you. We understand that our long-term success will define itself based on your success as an agent or as an agency. So reach out to us today. We'd love for you to be a part of MAS if you're not already. Due to time, we're going to wrap it up here, but our number here, feel free to give us a call anytime, is 1-800-480-9857, 1-800-480-9857, or you can reach us there at www.medadvspc.com. We'd be more than happy to answer any questions from today's webinar, or speak to you about what we can do for you as an agent to help you grow your business, and many, many more things that we could share with you. To leave you with a quote from W. Clement Stone, the reason so few people are successful is no one has yet found a way for someone to sit down and slide uphill. I'll leave you with that thought. Again, if you have questions, 1-800-480-9857. Thank you guys so much for taking time to be on our webinar today, and pay close attention to your emails. We have these quite often, so we'd love for you to jump on anytime that you want. And again, Zonta, thank you for your time. With that being said, hope everybody has a fantastic day and a great AEP.
Thanks, James. Thanks, Shanna.
You bet.